we start from the very beginning, right? If we start from the very beginning of someone coming in and they have a wound, right? So they come in, first time eval, you see them coming in and they have a wound. Doesn't matter how new or how old, you just see that they have a wound. You have to think about your approach, right? Your approach, what are you gonna say off the bat, and then what are you gonna do off the bat, right? So let's say, regardless of whatever they have, they come in, their hand is somehow wrapped, right? The first thing you do is, the first thing you say is something reassuring. So you have to reassure them, right? But you also have to tell them step by step what you're going to do, what's going to go on. It's so important that you give them step-by-step direction. Imagine you going somewhere and you have no idea where you're going, you don't know what they're going to do. And that's how your patients are approaching you every single time they have a wound. I swear, even if they know you, they know something's going to happen. They just don't know what it is. Right? They just don't know what it is. And so you really have to assure them that you know what you're doing, right? And that you're not going to do anything to hurt them. You're only here to help them. So off the bat, at an eval, that's what I'm going to say. Hey, so-and-so, my name is Huang. I'm going to be your occupational therapist today. And I see that your hand's completely covered up. Tell me a little bit about what's going on, right? So you start your eval and blah, blah, blah. And perfect. I'm so glad you're able to tell me a little, don't even touch them. Just, you can have them relax. You can have them take off their I'm thinking of the word in Spanish. Can you imagine? The sling. Take off their sling and just relax. Just tell me, let's start off with telling me what the story is. I'm not going to even touch you. I'm not going to do anything just yet. Perfect. Tell the story. The story will tell you a little bit about, or potentially outside of the script, right? Great. I love that, you're telling me everything right now. So before I do anything, I just want to assure you, I'm going to tell you exactly what we're doing so you're not scared, you're not worried that I'm going to hurt you. Actually, I'm going to help you, right? Our patients need to be told what they're doing. So I'm going to tell you exactly what we're doing. So for example, let's start with, they have a post-op dressing, right? So let's start in that beginning stage. They have a post-op dressing. Oh my God, you just had the surgery 3 days ago? Perfect. I'm so glad I know that. It's almost like, so glad you told me. It definitely confirms what I already know. Perfect, right? How do you feel? How's your pain? Perfect. They're always going to have a certain amount of pain. I'm going to take whatever their pain level. I'm going to say, okay, I'm doing nothing. You're in a lot of pain. Okay, perfect. So what I'm going to do today is I'm going to help you to feel better. I'm going to remove all the dressing, right? And then we're going to take a look to see what we need to do next in terms of cleaning it, but I'm not here to hurt you. I'm actually going to help you feel better. You might be surprised that once we take off all this bulky dressing, you might feel a lot better, right? So let's say you're doing a post-op dressing, they might need a splint next, right? So you have to tell them step by step. So after I take off the dressing, what I'm going to do is I'm going to clean it. I'm going to take a look at what's going on. And I'm going to show you, what's going on, what's going really well with your hand right now. And then after that, depending on how it looks, we might start moving it, but we're going to start really easy. We're going to start really slow, and we're going to start in as a pain-free range as possible, right? So you want to definitely give them that step-by-step, but you have to reassure them, and then you're going to give them that step-by-step. And then the next part is the doing part, right? So I'm going to take your dressing off. So you want to give them the direction or telling them exactly what you're doing and then what you're about to do next, right? So when you start to take off your dressing, in your mind, you need to know what you need to do to stabilize them so they have the least amount of pain, right? And that pain means you don't want to have them to move in one direction, this direction, this direction, that direction. You don't want them to have to move all over the place. You want to keep them stable and then remove the dressing, right? So one of the biggest things that I do is I have scissors. that have a bunted edge, right? So if they come in with a really thick post-op dressing, then I take off the ACE bandage and I try not to pull and tug as much as I can. If I see it taped down, if it's not easy to remove, I'll cut it off, right? It's because you don't want to pull and create a lot of jarring. The more that you're hurting somebody right at the beginning of their care, the harder it's going to be for them to trust you. So that's the biggest thing. Your first phase is that you're just, you're trying to get them to trust you, right? So you're going to take off the post-op dressing, take down post-op dressing, right? Now I take off the ACE bandage first, and then usually under the ACE bandage might be the batting, right? Or it might be the cast, that plaster cast that's there. So you have to, in your mind, have an idea of where the incision is, right? So if it's in the hand, if it's in the wrist, if it's in the elbow, you have to have an idea of where that incision is so that you can try to cut wherever the incision is not. If they have an incision and they see you come in with a pair of scissors, imagine, holy shit, what are these people doing? They're gonna hit the area that hurts me the most, right? One thing that I always do is I'll take my finger and I'll run it under the batting, and then I'll lift it up. I'll try to loosen it, and then with my finger underneath it, I'll lift it, and then I'll start to cut. And I cut the batting. I cut as much of it off. If they're here like this, you can do as much as you can, and at some point you might have to put them down. What you want to do is we want to try to move them the minimum amount as possible. So in a way, you're having to critically think through, where are they going to be the least amount of pain or problems? Are they up here, or are they going to be down at the table like this? But what you don't want to do is have to constantly have them moving up and down, right? So you're going to take down the post-op dressing, and then a lot of times there's going to be like bulky extra gauze, right? You have to decide where that's coming from, because a lot of times we had this one guy who came in and their dressings are interwoven, especially if it's in the hand, it's interwoven in between the fingers, and you want to be able to pull that off. Now, if you feel like there's some resistance because there's dry blood, you can, one, pour saline on it so that it'll loosen it up, or two, you want to hold their skin with one hand and pull it off with the other hand. Now, if you're 3 days, so we just had a patient, he was 1 day post-op. I don't wet the incision until it's at least 3 days. You want to look at that incision and you want to see that it's healing, because if it's not healing yet, you don't want to get it wet, because then it's gonna slow that incision coming together. So I usually wait 3-4 days before I clean with normal saline. I might clean around it if it's really bloody and stuff, but this guy came in nice and clean, and he still had the zero form. So the zero form, I think it's a zero form is pretty much that yellow gauze that you're gonna see, and the zero form is normally used after to keep the dressing from adhering to any bleeding. So that's all it's for. It's a non-adherent dressing. Got a little bit of extra, medicine on it, but for the most part, if you really think about it, it's just a non-adherent dressing so that the gauze doesn't stick to it. So you take down that, you can change the zero form. So the guy that came in that was 1 day post-op, I left his zero form on, and I just totally changed the gauze, and then I rewrapped it, but less bulky so that he could move, right? Because he was a capsulectomy. So a capsulectomy, he has incisions all on the back of his finger. We actually took some videos yesterday, so I'm gonna put them together and I'll put them in the program for you guys to see like what we did to take it down, right? But incisions on the back of the hand, you want to, and one of the reasons why I also didn't want to wet it after the first post-op day, because he's a capsulectomy and I need to move him. So he's coming in day 1 because I need to move those fingers right away. Now, if I wet them, I risk kind of letting the incision open. And I didn't want to do that. I needed to take off his bloody dressing, put new dressing on so it could absorb any blood that's coming from us having to move him a little bit, right? Where your incisions are does make a difference. If you have a flexor tendon or anything in the palm that is dirty and crusty, you definitely want to clean it, right? But still, again, I wait 3 to 4 days and then I'll start to clean it, because if it's dirty, if it's crusty, you can't see what's healed underneath. So you want to get some normal saline with a 4x4 and scrub it, right? So that's what you do. So before you do the next thing, right, you're taking down the dressing. I'm going to remove the form. I'm going to take a look at it. Your incisions look really good. I always tell people that. Oh my God, it does? Yes, that looks really good. Do you know that that gives them such relief? You know, if I don't think that it looks that good, I'll be like, you know, it's a little what I call dirty, but we're gonna be able to clean that up and make it look real nice. It's literally what I tell them. We're gonna make it look better so that you can feel better about your hand, so you can feel better about it moving, and that you're not so scared about it. Because the only way for us to progress in our therapy is to make sure that all your wounds close up real nice and pretty, and that way you can keep moving, right? So you wanna tell them all that. And so if you're about to touch anyone with any gauze or anything like that, like if you're going to clean it, so let's say it's day 5, pretend it's day 5 or greater. I'm gonna remove all your dressing blood. I'm gonna clean with normal saline. They see something white and clear, they think you're cleaning them with alcohol. And I have been to some surgeons' practice where their therapist cleans with alcohol swabs. I don't know how they do it. Their patients just sit there and like, yeah, no, it doesn't bother at all. But if you have an open one, like a small incision, whatever, but like some of the bigger ones, alcohol is extremely drying. You know what's drying? Alcohol, peroxide, and water and soap, right? All of these things are very drying. Alcohol is extremely drying. So if you follow what Vanessa said about, you know, your wound borders need to be, you know, not too dry. When it's very dry, the word you're using is desiccated. If it's too wet and it looks really whitish, it's macerated, right? And when it looks really good, it's healing well. But alcohol is very drying on the borders, and peroxide is extremely drying everywhere. Peroxide is, and it's funny because I've had surgeons' office call and ask me, or I've been to certain you know, conferences, and I'll talk to surgeons and they'll be like, what do you use? No, I never use peroxide, because peroxide's really drying. Peroxide's really great is if you have a very superficial wound and it's got debris. So let's say you fall and you scrape, right? The initial time that you put it on bubbles and takes everything to the surface so you can clean it, right? Soap and water is extremely drying as well. So even though this is the preferred method, and normal saline is just water, right? It's just sterile water in a bottle that you have to buy. In the United States, you have to have a prescription in order to get like normal saline, right? Nowadays, they sell like the saline spray or whatever, but I'd be hard pressed to use that right onto a wound or anything like that. But water does the same thing. What about finger amputations? Do I have patients soak? No, I don't soak, I clean. So the only time you soak, I guess, is if you have really hard debris. So if you had a flap, then you would have like a big amount of dead skin on there. So I don't usually soak, but what I do is I have them wash their hands with soap and water and use a clean 4x4. So every time I have my patients wash with soap and water and I want them to scrub a little bit firmer, I give them a 4x4, or I tell them at home, use a 4x4, soap and water, and use it to scrub, because it's the scrubbing part that helps to like exfoliate and take some of that dead tissue off. Now in an amputation, if they have a graft over it, Jackie, are you thinking about like when it's really hard and crusty? and it looks like you have to take off that scab, because if that's what you're thinking, then that's what you kind of have to do.
Yeah, like, and then initially when you take them off, it seems like the patients that I always work with, it always seems like that surgical dressing is always really stuck on there.
Yeah, so when it's stuck on there, I'll pour normal saline on it and then get it wet and take it off. You can use water too. Just have them run it under the sink, and then that way you can hold the skin and then take the gauze off. And then after that, you just clean with gauze and stuff like with just soap and water and gauze. And I just go into the bathroom right with them, help them scrub it off. If I have something that's kind of like caked on like that, I will actually get like the 4x4, soak it with the normal saline and let it sit there for a few while. And then I'll be able to scrape it off, right? But a lot of times when I'm going to clean them, I just tell them first, and then majority of the time I'm using normal saline for the first couple of times, and then after that I'm just like in the sink, soap and water. As long as they're not bleeding, you know, and they're mostly healed, then it's soap and water in the sink. So essentially that's what I do, clean with normal saline, and then it comes to wrapping them up.
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.